Good evening, everyone. So, have you gone through the anatomy of uterus as I told you in the last class? आप लोग ना क्लास के पहले, अगर आप विद इन वीक नहीं रिवाइज कर पा रहे तो क्लास के पहले एटलीस्ट एक क्विक रिवीजन कर लो, जैसे कि पिछली बार तो बात हुई थी एनाटमी के लिए। एनाटमी ही लेके चलते हैं, तो ये बेसिक से ही स्टार्ट करना सही रहेगा।
Parts mean like fallopian tube and ovary and
yes, but tell them in a systematic way, no? First of all, if anyone asks you about the female reproductive parts, so you can say it can broadly be divided into the external genitalia, internal genitalia, and accessory reproductive organs. In the external genitalia, by anteriorly by mons veneris, labia majora, and posterior is perineum. And when towards the internal genitalia, starts from the vagina, goes towards the uterus and fallopian tubes in both the sides, bilaterally and bilateral ovaries. And accessory organ is breast. That is
ma'am,
doesn't
please
directly.
can you share the PPT again? I've lost that.
Okay, it is there in the group. I'll share it again.
Okay, ma'am, thank you.
About the uterus, the volume of the uterus is very low, and the shape and size and weight is high because of the thick musculature. And why the thick musculature is there? The nature has prepared everything in such a systematic way to protect the developing life within the uterus. It is very important to have a strong protective system. First, it is covered by the pelvic bone, and inside the pelvic bone, even the musculature of the uterus is very thick, and to provide the nutrition and protection, and many of the functions are related. So, thick-walled muscular organs with a narrow lumen, and narrow lumen because the volume is less, and present in the pelvis between the urinary bladder and the rectum. So anteriorly it is by the urinary bladder and posteriorly by the rectum. I'm going very fast because we have gone through all these lectures. You may ask for the further slides or links of those classes. It's just revision. So what's the anterior? Which organ is in anterior of the uterus and which is in the posterior of the uterus? The urinary bladder in the anterior and rectum in the posterior. These are the basic idea that is must to know by any of the person related with the medical profession. And if you are from DGO, then we can't say how important it is. So superiorly on each side, uterine tube is there, or you can say fallopian tube. Dimensions of the uterus are, just to remember in easy terms, you can say length, breadth, thickness 3 to 1 in inches, and 3 inches approximately 7.5 centimeters, 5 centimeters, and 2.5 centimeters in respectively length, breadth, and thickness. And breadth is different in overall, so it is basically the breadth at fundus. And weight is approximately between 50 to 70 grams in nulliparous. Nulliparous, that is not a woman or female that never been pregnant, is nulliparous. And at the full term of the delivery, before the delivery, it can goes up to the 1000 grams, or we can say 1 kg. And the volume in the non-pregnant uterus is 10 to 20 ml, and in the case of pregnancy, it increases up to the 5 liters. So what are the parts of the uterus? First, we discussed about the reproductive system. In the reproductive system, we divide into the external genitalia, internal genitalia, and accessory reproductive organs. And internal genitalia, as we discussing about the uterus, and for the uterus also, it is further divided into two main parts. That is larger upper T-shaped part, the body, and the small lower cylindrical part, that is cervix. And most of the divisions are as per the anatomical features or the functions they do. So if you just correlate everything, it will be easy to learn the anatomy or physiology and further functions. And and further pathology related to that organs. So it is broadly divided into two parts, that is body, that is upper pear-shaped part, and the lower small cylindrical part is cervix. बॉडी जो है अपर लार्ज पार्ट है तो 2/3 है और सर्विक्स जो है 1/3 लेता है of the whole uterus. So just close your eyes and imagine the structure of the uterus, pear shaped, that is broad towards the upwards and going narrower towards downwards. Just close your eyes and imagine it is the larger part that is makes 2/3 of the uterus. And what is that? The body of the uterus. And below the body is attached the cylindrical cervix, and it makes the 1/3 of the uterus. And junction between the body and cervix is circular constriction called isthmus. So what is the junction of body and cervix? It is isthmus, and it's a circular ring like 0.5 centimeter circular constriction called isthmus. The point of fusion between the uterine tube and the body is called coronia of the uterus. So the junction of the cervix and body is isthmus, and junction of body of the uterus and uterine tube or fallopian tube is cornea of uterus. So cornea of uterus is also a juncture, and isthmus is also a juncture. Isthmus is downwards with the cervix, and cornea of uterus is bilateral with the fallopian tubes. So these are broadly the parts of the uterus and junctions with the other parts of the uterus. And when we discuss about the body of the uterus, above the opening of uterine tubes, a dome-like and called fundus. So fundus is a dome-like structure, and uterine tubes are attached to that. Smooth muscle tissues of the body, and that musculature is thick, approximately 2.5 centimeters. And about as we discuss about the musculature, so it is divided in the 3 layers, as it is mostly divided: outer, middle, and inner layer. And of the outer layer, longitudinal fibers are there. In middle, crisscross, which contains the, and in the middle layer, the blood vessels and living ligatures are there, and the inner layer is with the circular muscular fibers. So when the question arises where the blood vessels or the nutritive values in the uterus comes is located, so answer is in the middle layer of musculature. And what is isthmus? Just in the previous slide we discussed. What is isthmus? Junction between the body and cervix. Isthmus forms a lower uterine segment at 24 weeks and complete at the labor. So when many of you who visited the indoors or labor room during the delivery time, you must heard about the opening of that is in the fingers or in the inches, that is 2 finger loose or 10 centimeters. So it is basically about the introduction with the LUS or the lower uterine segment. At term 70% of isthmus and 30% of cervix, that forms the lower uterine segment. Basically, it is by the isthmus, and at the full term, with the cervix, it is required to have the proper opening to have external delivery of the fetus. So, and this segment forms the lower uterine segment, and during labor time, it measures up to the 10 centimeters. These are the basic structure of the uterus.
Madam, cannot see any slides.
Slides are not visible?
No, ma'am.
Just a minute. You have to tell me, na? Sharing once again. We discussed 3 slides.
Yeah, I thought you are just telling.
No. Just a minute. So suppose it is the uterus. So anterior, it's the, and one side is anterior and another is posterior. So towards the anterior boundary is the urinary bladder, and towards the posterior boundary is the rectum. And the space formed between the uterus and the bladder is utero-vesical pouch, and towards the posterior side between the uterus and rectum is pouch of Douglas. And sometimes due to the extra pressures during the constipations or during the urinary tract infections or infections or some operative complications or in the uterus or during the delivery time to the external pressures with the jerky deliveries, there might be the chances of further rupture and leakage from these pouches. So it is the severe complication. So as we discussed about the structures, the external genitalia, and after that the internal genitalia, and the uterus is further divided into fundal part, that's the upper two-third, and the lower cylindrical parts, that's vaginum, and the ring-like structure is the isthmus, and that isthmus combines with the vaginal part to form the lower uterine segment during the pregnancies. And about the uterus also, it is a thick musculature, and the that's the walls is the thick muscle, and the narrow lumen जो अंदर का passage रहता है, that is very narrow, and that may grows wide during that at the time of delivery up to the space of 500 ml, and weight of the uterus to supply nutrition and other supports to the fetus. It also grows wide up to the extent, and for the uterus, at the both side of uterus is the fallopian tube, and fallopian tube is towards the both the ovaries. These are the basic anatomical structures, and that uterus and fallopian tubes and ovaries, तो ये ऐसे फ्लोट तो करेगी नहीं आपके बॉडी में, तो उसको भी कुछ सपोर्ट चाहिए कि वो अपनी प्लेस पे स्टैंड रहे. तो the ligaments are there to help to be there in the place and to perform their functions. So these ligaments that connects the genital parts to basic other strong structures are true ligaments, and some ligaments that doesn't have connectivity, proper connectivity to the other system. These may be called as false ligaments. And one of the vast of the ligament is broad ligament that covers major part of the uterus and the ovaries. I'll share the slides and just go through those slides. It will be clear with those pictures. So the area the broad ligament covers, it contains many of the other parts like ovarian arteries, and I'm once again trying to share the slide. So we were discussing about the ligaments. So the structures that are proper ligament, what are the ligaments? I hope you have studied about those structures in the anatomy. The connecting tissues. So those that are really the connecting tissue between the uterus and other bony structures are true ligaments like ovarian ligaments, and some of the ligaments are just a fold of the peritoneum above the part of the uterus is the abdominal cavity, and some part of the peritoneum forms the ligament-like structure. So that broad ligament is the folds of the peritoneum that covers and supports the many of the uterine structures like ovarian artery and fallopian tubes, and many of parts lies in that area of the broad ligament only. So it covers a huge space and support to the uterus. So these are the basic anatomical structures regarding the uterus. And towards the cervix, you might have heard the words like nulliparous. Anatomy is better to study with the slides, I think. Are you clear about the antenatal care? We can discuss those topics verbally. And about the anatomy, it is important to. या आपको कोई और confusions हैं? आपके सारे topics covered हैं जितना syllabus के हैं? Okay, so after the anatomy, we will discuss about the process. As we know, the uterus, then fallopian tubes are connected, and after that, ovaries are there. The function of ovaries is to form ovum or the female part, or the you can say the beach from the female side. At the time of ovulation, once in a month, that ovum will goes is collected by the fallopian tubes, and in the isthmus part it will be there, and if any sperm will there, it gets fertilized, and it will be there after 1 week approximately, and after that it is implanted in the uterus, and after that it will grow gradually. Until then there is division. ऐसा नहीं कि वो एक सेल ही वहां पे आती है, तो जो फर्टिलाइजेशन के बाद वो एक सेल डिवाइड होके फिर नंबर ऑफ सेल्स वो इम्प्लांट होती है यूट्रस की तरफ, और ना ही ऐसा भी नहीं कि सीधे यूट्रस में ही फर्टिलाइजेशन होता है. फर्टिलाइजेशन इज देयर इन द फैलोपियन ट्यूब इन द स्टमक पार्ट, देन इट गोज आफ्टर अ वीक इन द यूट्रस, और फिर यूट्रस में भी वो जो थिक मस्कुलेचर है तो उसकी वॉल पे अटैच्ड रहती है, क्योंकि वो फ्री फ्लोटिंग तो फिर फ्लो आउट हो जाएगी, तो वॉल पे उसको अटैच्ड रहती है. फिर धीरे धीरे उस वॉल में ही, जैसा कि हमने देखा था कि मिडिल लेयर में बात हुई थी, देखा तो नहीं था सॉरी, बिकॉज स्लाइड्स आर नॉट विजिबल, आई विल शेयर दैट. जितना अभी एनाटॉमी बताया है तो उससे रिलेटेड ही जो फीमेल रिप्रोडक्शन का पार्ट है दैट आई एम एक्सप्लेनिंग यू. तो वॉल्स पे अटैच्ड रहते हैं, और उसी वॉल से फिर न्यूट्रिशन होता है एंड डिवीजन होता है, फर्दर सेल डिवीजन होता है, और वो डिवाइड होते होते it will that zygote, and zygote will take form of the embryo, and later on it goes towards the fetus. So these are the basic structure, and if there is not any fertilization, so फिर that ovum will wait for a while, and gradually वो preparations भी endocrinal walls पे होती रहती हैं for the fertilization. So if there is no fertilization, in the last class we discussed about the menstrual cycle. So according to that, that ovum and all the preparations will flow out, and the causative factor for that, the hormones. That body is regulated by the several hormones, जैसे कि हमने HPO एक्सिस के hormones के बारे में लास्ट क्लास में डिस्कस किया था. तो hormones के ब्रेन को सिग्नल जाता है कि there is not any no fertilization is there, तो hormone secretion कम करने को फिर वो hormone secretions गोनेडोट्रोपिन रिलीजिंग हार्मोन से पिट्यूटरी की तरफ जाता है, फिर पिट्यूटरी ओवरीज को सिग्नल्स देती है, तो सारे हार्मोन्स का लेवल जब कम होता है तो वो मेंस्ट्रुअल ब्लड फ्लो के रूप में जितनी भी प्रिपरेशंस थी वो शेड आउट हो जाती है, एंड अगेन इन द अनदर साइकिल द सेम प्रोसेस विल बिगिन विद द डेवलपमेंट ऑफ ओवम, एंड दैट ओवम गोज अगेन टू द fallopian tube, and after from that fallopian tube it will all the preparations by the uterus for the pregnancy will be there, and if any pregnancy is there then it will continue, otherwise it will shed out. And to support that growing fetus, it is a normal and natural process, and many other investigations और जो भी हमारी antenatal checkup में with the growing fetus the requirements also increases. So dietary regulations are guided कि डाइट कैसे लेनी चाहिए, and the demands of calcium and iron in the Indian scenario is not fulfilled by the normal diet, तो external जो supplement iron और calcium का दिया जाता है as per the protocol, because of that only. And in some females the protein requirement is also raised, तो protein supplements भी देते हैं, और as per the conditions other things are also given. And आप लोगों ने सुना होगा इको एस्पिरिन भी कई डॉक्टर्स चलाते हैं ड्यूरिंग द प्रेगनेंसी, तो व्हाट इज द रोल फॉर दैट? फार्माकोलॉजी अगर आप लोग ने पढ़ा होगा तो एस्पिरिन और इको एस्पिरिन की ब्लड कोआगुलेशन से रिलेटेड कुछ है उसका रोल? just go for the ecoaspirin. Like basically उसका aim ये रहता है, I am not supporting to give ecoaspirin during the pregnancy or not against of that, I am just explaining you about the role कि वो blood flow जो रहता है कि आपको proper supply होता रहे यूट्रस की तरफ, और बहुत ज्यादा भी फ्लो नहीं, मतलब to maintain that aspirin is given कि कई बार पूरा सप्लाई यूट्रस तक नहीं जाता है. तो by other means also, as you are from the naturopathy course or DAGO, that is Ayurvedic gynecology or obstetric course, तो similar action के drugs हम उसको ऐड कर सकते हैं, that is safe during the pregnancy and to maintain the pregnancy. And in Ayurveda also the month wise drugs are described कि अगर प्रेगनेंसी में कुछ कॉम्प्लिकेशंस आती हैं तो कौन से मंथ में कौन सी ड्रग्स देनी है. एंड फॉर द नॉर्मल प्रेगनेंसी ऑल्सो गर्भिणी परिचर्या इज डिस्क्राइब कि उसको डाइट कैसा होना चाहिए ईच मंथ वाइज. फर्स्ट मंथ में या फर्स्ट 3 मंथ्स में मधुर शीतल द्रवाहार, क्योंकि उसमें हाइपर एमेसिस ग्रेविडेरम की कॉम्प्लिकेशंस बढ़ जाती हैं, तो कुछ डाइल्यूट सा थोड़ा स्वीट की आपको एनर्जी भी मिले, और बहुत गरम गरम नहीं कि उसमें आपके जीआई ट्रैक्ट एग्रावेट हो, फिर नोजिया वोमिटिंग हो, तो आपकी डाइटरी सप्लीमेंट्स भी पूरी हो जाएं और जो कॉमन कॉम्प्लिकेशंस होती हैं प्रेगनेंसी की उसको भी